Melanoma. What is melanoma? Melanoma is a disease in which malignant cancer cells form in the skin cells called melanocytes. These are the cells that color the skin. Melanocytes are found throughout the lower part of the epidermis. They make melanin, the pigment that gives skin its natural color. When skin is exposed to the sun, melanocytes make more pigment, causing the skin to tan or darken. Melanin protects the deeper layers of the skin from some of the harmful effects of the sun. Other names for this cancer include malignant melanoma and cutaneous melanoma. Because the most melanoma cells still make melanin, melanoma tumors are usually brown or black. But some melanomas do not make melanin and can appear pink, tan, or even white. Melanomas can occur anywhere on the skin, but they are more likely to start in certain locations. The trunk, which is the chest and back, is the most common site in men. The legs are the most common site in women. The neck and face are other common sites. What causes melanoma? Researchers have learned a great deal in recent years about how certain changes in DNA can make normal cells become cancerous. DNA is the chemical in each of our cells that makes up our genes. This is the instruction for how our cells function. DNA affects more than just how we look. Melanoma occurs when something goes wrong in the melanin-producing cells, the melanocytes. Normally, skin cells develop in a controlled and orderly way. Healthy new cells push older cells toward the skin surface, where they die and eventually fall off. But when some cells develop DNA damage, new cells may begin to grow out of control and can eventually form a mass of cancerous cells. Just what damages DNA in skin cells and how this leads to melanoma isn't clear. It is likely that a combination of factors, including environmental and genetic factors, causes melanoma. Still, doctors believe exposure to UV radiation from the sun and from tanning lamps and beds is the leading cause of melanoma. UV light doesn't cause all melanomas, especially those that occur in places on your body that don't receive exposure to sunlight. Symptoms of melanoma. Normal moles are generally a uniform color, such as tan, brown, or black, with a distinct border separating the mole from your surrounding skin. They are oval or round and usually smaller than a 1/4 inch, which is about 6 millimeters in diameter. This is about the size of a pencil eraser. To help identify characteristics of unusual moles that may indicate melanoma or any other skin cancers, we use the rule called the ABCDE rule. A is for asymmetrical shape. These moles have irregular shapes, such as two very different looking halves. B is for irregular border. Look for moles with irregular, notched, or scalloped borders. C is for changes in color. Look for growths that have many colors or an uneven distribution of color. D is for diameter. New growths in a mole will grow larger than a 1/4 inch. E is for evolving. Look for changes over time, such as a mole that grows in size or that changes color or shape. Moles may also evolve to develop new signs and symptoms, such as new itchiness or bleeding. Other suspicious changes in a mole may include scaliness, spreading of pigment from the mole into the surrounding skin, oozing, or even bleeding. Cancerous moles vary greatly in appearance. Some may show all of the changes listed above, while others may have only one or two unusual characteristics. The diagnosis of melanoma. Usually the first step is for a doctor to take the patient's medical history. The doctor asks when the mark on the skin first appeared, if it has changed in size or appearance, and if it has caused any symptoms, such as pain, itching, or bleeding. The doctor also asks about exposures to known causes of skin cancers. including sunburns, and if anyone in the family has had skin cancer before. During the physical exam, the doctor will note the size, shape, color, and texture of the area in question, and whether there is bleeding or scaling. The rest of the body may be checked for spots and moles that could be related to skin cancer. The doctor may also feel the lymph nodes, which are small, bean-shaped collections of immune cells, under the skin, in the groin, underarm, or neck near the abnormal area. When melanoma spreads, it often goes to nearby lymph nodes first. Enlarged lymph nodes might suggest that any melanoma present may have spread there. Along with a standard physical exam, many dermatologists use a technique called dermatoscopy. It is also known as dermoscopy or surface microscopy to see spots on the skin more clearly. The doctor uses a dermatoscope, which is a special magnifying lens and light source held near the skin. Sometimes a thin layer of oil is used with this instrument. The doctor may take a digital photo of the spot. When used by an experienced dermatologist, this test can improve the accuracy of finding skin cancers early. It can also often help reassure you that a spot on the skin is likely benign, which is non-cancerous, without the need for a biopsy. If the doctor thinks a spot may be a melanoma, he or she will take a sample of the skin from the suspicious area to be looked at under a microscope. This is called a skin biopsy. For a shave biopsy, the doctor first numbs the area with local anesthetic. The doctor then shaves off the top layers of the skin with a small surgical blade. Usually just the epidermis and the outer part of the dermis are removed, although deeper layers can be taken as well if needed. Bleeding from the biopsy site is then stopped by applying an ointment or a small electrical current to cauterize the wound. Another type of biopsy, a punch biopsy, removes a deeper sample of skin. The doctor uses a tool that looks like a tiny round cookie cutter. Once the skin is numbed with a local anesthetic, the doctor rotates the punch biopsy tool on the surface of the skin until it cuts through all the layers of the skin, including the dermis, epidermis, and the upper parts of the subcutis. The prognosis of melanoma. Before discussing the actual survival rates of melanoma, it is important to know the different stages of melanoma. There are 4 different stages, each divided into A and B groups. As the stage goes higher and higher, such as 3B to 4A, the tumor becomes thicker. Survival rates are often based on previous outcomes of large numbers of people who had the disease, but they cannot predict what will happen in any particular person's case. Knowing the type and stage of a person's melanoma is important in estimating their outlook, but many other factors may also affect a person's outlook, such as the genetic changes in the cancer cells and how well melanoma responds to treatment. Even when taking these other factors into account, survival rates are at best rough estimates. The doctor can tell the patient if the numbers below may apply, as he or she is familiar with the particular situation. Other factors aside from the stage may also affect survival. For example, stage for stage, older people generally have shorter survival times. The biggest drop begins at age 70. Melanoma is uncommon in African Americans, but when it does occur, survival times tend to be shorter than when it occurs in whites. Some studies have shown that melanoma tends to be more serious if it occurs on a foot, palm, or nail bed. People with organ transplants or HIV infection and melanoma also are at a greater risk of dying of their melanoma. Treatments for melanoma. The treatment of melanoma differs depending on the stage at which melanoma is at. For example, stage 1 melanoma is treated by wide excision, which is a surgery to remove the melanoma as well as a margin of normal skin around it. The amount of normal skin removed depends on the thickness of the melanoma. Wide excision is the standard treatment for stage 2 melanoma as well. If the melanoma is between 1 and 2 millimeters thick, a margin of 1 to 2 centimeters of normal skin will be removed as well. And because the melanoma may have spread to lymph nodes near the original site, many doctors recommend a sentinel lymph node biopsy as well. In stage 3, the melanoma cancer cells have already reached the lymph nodes. Surgical treatment for stage 3 melanoma usually requires lymph node dissection along with wide excision of the primary tumor as in stage 2. Adjuvant therapy with interferon may help some patients with stage 3 melanomas fight off recurrence longer. Another option may be to give radiation therapy to the areas where the lymph nodes were removed, especially if many of the nodes contain cancer. Stage 4 melanomas are very hard to cure, as they have already spread to the distant lymph nodes or other areas of the body. Skin tumors or spread to lymph nodes causing symptoms can often be removed by surgery. Metastasis in internal organs are sometimes removed depending on how many there are, where they are located, and how likely they are surgically may be treated with radiation, immunotherapy, targeted therapy, or chemotherapy. Treatment of melanoma that comes back after initial treatment depends on the stage of the original melanoma, the prior treatment, and the site of the recurrence. Melanoma may come back in the skin near the site of the original tumor. In general, these local skin recurrences are treated with surgery similar to the recommended for a primary melanoma. This may include a sentinel lymph node biopsy. Depending on the thickness and location of the tumor, other treatments may be considered, such as isolated lymph perfusion, chemotherapy, systemic chemotherapy, immunotherapy, radiation therapy, or tumor injection with vaccine or interferon. It's important to remember that there are ways to prevent melanoma. The most important way to lower your risk of melanoma is to protect yourself from exposure to UV radiation. Practice sun safety when you are outdoors. Simply staying in the shade is one of the best ways to limit your UV exposure. If you are going to be in the sun, slip, slop, slap, and wrap is a catchphrase that can help you remember some of the key steps you can take to protect yourself from UV rays. Slip on a shirt, slop on sunscreen, slap on a hat, and wrap on sunglasses to protect the eyes and sensitive skin around them. In researching melanoma, I found a few fun facts, but there are a few that stick out to me. For example, 1 in 50 Americans will develop melanoma in their lifetime, and it's the fastest growing cancer in the US and worldwide. Also, it is projected that nearly 80,000 Americans will be diagnosed with melanoma in 2013. That means that one person is diagnosed with melanoma every 8 minutes. It was really fun and interesting in researching this information about melanoma. I hope I didn't bore you too much and hope you enjoyed listening.